Expert perspectives in MBC, ESR1 mutations and treatment challenges. Jules Cohen, MD, Associate Professor of Clinical Medicine, Stony Brook University, New York. Indication: ORSERDU, elacestrant, is indicated for the treatment of postmenopausal women or adult men with estrogen receptor ER-positive human epidermal growth factor receptor 2 HER2-negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least one line of endocrine therapy. Important safety information, warnings and precautions. Dyslipidemia, hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27%, respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2%, respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Full important safety information will follow this video. ESR1 mutations and treatment challenges.
In the first line, in patients who are naive to therapy in the metastatic or advanced setting, the incidence of an ESR1 mutation is low, it's under 5%. After failure of first-line therapy, which generally is some sort of endocrine therapy plus a CDK4/6 inhibitor, the incidence of an ESR1 mutation goes to about 40%. And most of those ESR1 mutations are so-called hotspot mutations and confer constitutive activation of the estrogen receptor in a way that is estrogen independent. So most anti-estrogens, certainly the aromatase inhibitors and the SERMs like tamoxifen, are ineffective at these constitutively active estrogen receptors. So we need a drug that goes beyond just blocking the effects of estrogen. We need a drug that actually causes the degradation of this constitutively active estrogen receptor. Tumor biology changes over time as it adapts to the selective pressure of prior endocrine treatment. ESR1 mutations confer poor prognosis upon my ER-positive, HER2-negative metastatic breast cancer patients, and they are a key driver of disease progression. As ESR1 mutations reflect what's driving the tumor today, I seek to urgently treat them.
Why, how, and when to test for ESR1 mutations?
I test at first-line progression because I want to know what's happening in the tumor today. Even if you know there is a PIK3CA mutation detected at metastatic baseline, I'd recommend testing for ESR1 mutations at first-line progression to reassess how the disease has changed. If an ESR1 mutation is detected, then that is new information and affects my second-line treatment decision. Liquid biopsy is my preferred method for detecting ESR1 mutations, as I find it to be most accurate in my experience. Tissue biopsies do not account for spatial heterogeneity or may represent a more difficult process for patients to go through. Testing with archival tissue is inadequate for detecting ESR1 mutations due to their acquired nature.
Prioritizing treatment when multiple mutations are present.
If my second-line patient has both an ESR1 and PIK3CA mutation, I choose to treat the ESR1 mutation first. The ESR1 mutation is more urgent to treat as it emerges directly from endocrine therapy exposure in the first line. I can address the PIK3CA mutation in later lines of therapy. In my opinion, the variant allele frequency, or ctDNA percentage on the test reports, do not contain any prognostic or clinical value. Therefore, I don't use that number to determine whether I treat the ESR1 or the PIK3CA mutation first in a patient co-mutated with both. I treat the mutation that I feel is driving her metastatic disease today. I would generally, again, base my second-line treatment decisions on my sense of whether or not the patient is endocrine sensitive in the second line and how well they did in the first line of therapy. Based on the complete clinical profile of ORSERDU, from the efficacy to safety to dosing, I recommend choosing ORSERDU for your second-line patients with an ESR1 mutation.
Indication: ORSERDU, elacestrant, is indicated for the treatment of postmenopausal women or adult men with estrogen receptor, ER-positive, human epidermal growth factor receptor 2, HER2-negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least one line of endocrine therapy. Important safety information. Warnings and precautions. Dyslipidemia. Hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27% respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2% respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Embryo-fetal toxicity. Based on findings in animals and its mechanism of action, ORSERDU can cause fetal harm when administered to a pregnant woman. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Advise male patients with female partners of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Adverse reactions. Serious adverse reactions occurred in 12% of patients who received ORSERDU. Serious adverse reactions in greater than 1% of patients who received ORSERDU were musculoskeletal pain, 1.7%, and nausea, 1.3%. Fatal adverse reactions occurred in 1.7% of patients who received ORSERDU, including cardiac arrest, septic shock, diverticulitis, and unknown cause, 1 patient each. The most common adverse reactions, greater than or equal to 10%, including laboratory abnormalities of ORSERDU, were musculoskeletal pain, 41%, nausea, 35%, increased cholesterol, 30%, increased AST, 29%, increased triglycerides, 27%, fatigue, 26%, decreased hemoglobin, 26%, vomiting, 19%, increased ALT, 17%, decreased sodium, 16%, increased creatinine, 16%, decreased appetite, 15%, diarrhea, 13%, headache, 12%, constipation, 12%, abdominal pain, 11%, hot flush, 11%, and dyspepsia, 10%. Drug interactions. Concomitant use with CYP3A4 inducers and/or inhibitors. Avoid concomitant use of strong or moderate CYP3A4 inhibitors with ORSERDU. Avoid concomitant use of strong or moderate CYP3A4 inducers with ORSERDU. Use in specific populations. Lactation. Advise lactating women to not breastfeed during treatment with ORSERDU and for 1 week after the last dose. Hepatic impairment. Avoid use of ORSERDU in patients with severe hepatic impairment, child PUC. Reduce the dose of ORSERDU in patients with moderate hepatic impairment, child PUB. The safety and effectiveness of ORSERDU in pediatric patients have not been established. ORSERDU is available as 345 mg tablets and 86 mg tablets. To report suspected adverse reactions, contact Stemline Therapeutics Incorporated at 1-877-332-7961 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including patient information.